Thank you, Daktari. Welcome.
Thank you very
Welcome.
much.
We've been waiting for you.
Poleni
Uh,
sana
I
for
had
the long
already,
wait.
uh, yes, we are aware. Thank you for coming and thank you for managing to come on board. I've introduced you. So we've wasted so much time, but I would just want you to, we continue. We can start and we continue. You are most welcome.
Thank you. Thank you very much. Okay, so we can move to the slide that's next. Okay, so just to give a recap of the things we've done in the past, we've talked about basically over healthy aging, what aging, normal aging looks like, what the physiological changes of aging are, and what that involves. So we are going to go into each aspect of healthy aging today, and we'll just go through why it's important. What is important about healthy aging? As we're aware, when our life expectancy increases, we start getting diabetes, blood pressure, osteoarthritis, and other NCDs or chronic diseases. It increases with increasing age. So, with healthy aging, you're not really trying to cure things. The real goal is what we call compression of morbidity. What that means is delaying the onset of disability so that people spend fewer years with dependency, right? Now, why is that important? Because things like early screening, lifestyle interventions, and vaccination programs reduce hospital admissions and lower the healthcare costs. Like, for example, when you get vaccinated for influenza, it is proven to show that hospitalization. There's, thank you. That it's proven to show that when you do vaccinations, like for example, the influenza vaccine, 60% of hospitalization because of a pneumonia is being reduced. So, healthy aging, all in all, is fundamentally about preserving independence and the quality of life. Next slide. Next. So, as we talked about this, what we want to also understand, sorry, we missed a slide, sister, that what healthy aging is, especially in geriatrics. It's not defined by the absence of illness, but by the person's ability to remain functional. So, for example, we will say an 80-year-old person who has controlled hypertension, who can cook and socialize, is usually healthier than a 60-year-old bedridden patient who may not have any chronic illness. So, the main aim of healthy aging is to maintain what we call functional ability. That is the bridge between capacity and the environment. Capacity meaning your internal and external capacity as a human being. What is our functional ability? Our functional ability as humans is made up of two things. What is happening internally in our bodies, which is our intrinsic capacity, and the environmental factors that have a play into this capacity space. So, the goal of healthy aging is independence, dignity, and resilience despite having an illness. It does not mean that we are disease free. And with the geriatric focus, we are looking mainly at early detection, a multidisciplinary care approach, and prevention of disability. So we often say that aging is not a pathology, but it's a physiological process, as we had talked about in the past webinars. And WHO goes on to maintaining that functional ability has to be maintained across the lifespan. So, what I want us to focus on as we go through this webinar today is to look at aging not as an inevitable decline, but as an opportunity to strengthen resilience, reduce the disease burden, and uphold dignity as individuals. Next slide. So, the 5 pillars of healthy aging are physical health, nutrition, mental and cognitive well being, social connectedness, spiritual and emotional resilience. Now, how we look at these 5 pillars is let's approach it like a foundation of a home. If any of them is weak, the whole structure becomes at risk. These five pillars are not just an opinion based by somebody who sat around discussing something and came up with an opinion. It's based both on evidence based practices and also lived experiences. Like, for example, when we talk about physical activity, you're looking at reducing the risk of sarcopenia and frailty. When you're looking at nutrition, you're looking at risk of managing undernutrition or overnutrition. When you're looking at cognitive health, you're looking at how does dementia or depression or any mental issue affect a person as they age. We'll go each pillar in details, but just as an overview, it's important to understand all pillars are interconnected. Now, when you're looking at all of them, they function like interdependent systems. Basically what we said, if one weakens, the risk of getting frail or hospital admissions will increase. As we go through this again, I want you on an individual level to also reflect on, out of these five pillars, which one is the strongest? Which ones do you struggle with, and why are you struggling with them? So hopefully by the end of this webinar, you'll feel a little more empowered to know how to intertwine each pillar and make all of them function as one full unit. This is why we say the practice of health is a holistic approach. You cannot look at each of these things in silos. Next slide. So, as we go into physical health and activity, we know that for WHO, they will recommend a certain time dedicated to exercise as we age. But when we grow old, or at any given point, whether you're 40 or 50, at least 150 minutes of exercise, which is moderate intensity and aerobic activity, especially over the ages of 65, is what is recommended. I'll repeat that. The WHO recommendation is 150 minutes of moderate intensity aerobic exercises for patients or people who are over 65. But that doesn't limit you to being over 65. If you're 40 and you do not get time, at least to try and get 150 minutes of exercise per week. If you divide that, you're looking at maybe about 15 or 20 minutes a day if you do exercises 5 days a week. Now, importantly, or more importantly, balance and resistance training reduce falls, which are one of the leading causes of injury related death in adults, older adults worldwide. Now, clinically, we get people who fall because of something we call sarcopenia. Sarcopenia is just the loss of muscle mass, and maintaining muscle mass is central in healthy aging. So, exercise is key in maintaining muscle mass. The other area that affects your physical movement and your muscle mass would be polypharmacy, things like impaired visuals, because you'll be at risk of falls. So, encouraging physical activity which is safe. Remember, what a 20-year-old can do may not be what a 50-year-old can do, and what one 50-year-old can do may not be the same as another 50-year-old. If I am going too fast, please raise your hands to slow me down. I know I'm rushing because we wasted about 30 minutes in trying me to connect. So please feel free to slow me down. So when we're looking at safe physical activity, you want to make sure resistance exercises are part of it, because resistance training is medicine, not only for fall prevention, but also cognitive function. And fall prevention is vital when you're looking at physical health and activity. When you prevent falls, you reduce a lot of risks of immobility, of physical disability, and things like that. Patients with chronic diseases, you want to have tight control over the disease, for example, hypertension or diabetes by regular follow ups. But physical activity and physical exercise will help control these diseases. So we want to control balance of the disease itself. Remember, I mentioned polypharmacy. Polypharmacy puts people at a very high risk of falls. So you want to balance quality of life over actually treating or over treating conditions. So when you're looking at physical health and activity, the critical areas in summary are movement, what kind of movement you're doing, which is now strength training and balance, fall prevention, and medication review, because medication review also leads to lesser falls, delirium, and drug to drug interactions. There's evidence in studies that have been done that show that structured exercise programs, that is where you have a routine and or structured program, not just randomly doing exercises, it helps reduce the risk of falls by up to 23% in older adults. Next slide. When we're looking at nutrition, let's talk about our situation in our country, Kenya. Healthy eating is always perceived to be an expensive affair, which is not necessarily true. It doesn't have to be expensive. Traditional diets provide excellent options. The main things we need to remember are what we need to eat. Proteins are vitals, and in our local diets, things like beans, dengu, the fish, eggs, chicken, lake fish like tilapia, these are very affordable and nutrient rich. When it comes to your vegetables, sukuma, kunde, is I think it's called terere managu. They give a lot of iron, calcium, and antioxidants, which is good for your brain. When you look at the fruits that are readily available in our local markets, pawpaws, mangoes, bananas, avocados, not necessarily expensive. They help with digestion, they help improve your immunity. However, when we look at our local staple diets, things like ugali, rice, those are staple foods. They are high energy foods. But we want to also remember as we are aging and we're looking at the healthy aging bracket, we want whole grains and portion control to be there and a higher protein intake. Another thing that's usually missed out when we're looking at our nutrition is hydration. It is very important that older adults or as we go into the later years, our hydration remains optimum to at least for males about 1.3 or 1.4 liters per 24 hours and females about 1.2 to 1.3 liters. Again, it's also combined with knowledge that if there are pre-existing conditions that um, push you in a space where you must, restrict your fluid intake like kidney failure and all, then it goes down to minimum of a liter or maximum of a liter. It is advisable to use water, things like uji or mala, to hydrate rather than the sugary drinks we tend to do, sodas and juices, packed juices. So when we look at the options, we need to understand that nutrition is medicine for aging. The right nutrition is very important. Adequate protein intake is very important because if you are going to be protein deprived, you're going to accelerate the risk of getting sarcopenia. Again, vitamins and nutrients and micronutrients are very important, especially things like vitamin D, vitamin B12, calcium. These help prevent things like osteoporosis and fractures. Vitamin B12 is very important because it is known to cause cognitive issues. So when you're screening for cognitive impairment, checking vitamin B levels is very important. And like I said, hydration is usually not spoken about enough. And also remember, as we age or older adults do not feel as thirsty, they have what we call a reduced thirst sensation, which means they can get dehydrated without realizing. They can dehydration can lead to kidney problems. It can lead to delirium. It can cause UTIs and it can lead to falls. So that is why hydration remains a very important pillar under the nutrition pillar. I have put some questions here, and these are all questions that I want us to keep thinking as we go through the webinar at a personal levels. Because a lot of times when we are looking at nutrition, when it comes to healthy aging, there is so much pressure that is put onto nutrition that people feel like they have to be on strict diets and follow. Oh, the doctor said I should eat zucchini and I should eat anchovies, and those are things that I don't know what they are half the time. So you're like struggling to maintain a diet that is not practical or sustainable. It is far more important to look at your local diet, what you can afford, what is sustainable, and use it to work towards a healthy eating habit and hydration habits. Next slide. Are we all okay so far? Any questions before I continue?
If there is any question, please put on the chat or you raise up your hand so that we don't leave anybody behind. Any question? Put on the chat or you raise up your hand. So far, there's no question, Doctor.
Okay, so we're okay.
Doc, we can continue.
We can continue. Okay. So back now to the third pillar, which is mental and cognitive health. We need to understand what cognitive health is. Cognitive health is our ability to function normally. How is cognitive reserve built over time? It's built through education, mental stimulation, and lifelong learning. When you have this in place, you're going to delay the onset of cognitive impairment, delay the onset of dementia, and things like that. When it comes to your mental and cognitive well being, we need to remember depression is very common in older adults. And if we are not focused on healthy aging, we often find ourselves at uh, a kind of a tug of war between our mental health and what is normal life changes. So it's very important to do screening for older people or people in their later years for what we call depression or late life depression. Something called the geriatric depression scale is used, and it is a validated tool that can pick up early depression signs and help create the support that is required to maintain mental and cognitive well-being as you go towards healthy aging. Depression affects about 20% of older adults within communities. And the worst part about depression is that when it's untreated, it accelerates or starts going towards cognitive decline, which then becomes an irreversible issue. Hearing and vision are also very important to understand because they are a reversible factor that affects cognitive health. Your inability to see well or hear well puts you at a far higher risk of cognitive impairment and mental strain compared to somebody who has no this impairment there. So that's why we say hearing aids should be accepted and should be universally availed as a human rights space for older people, because the loss of hearing can really cause a lot of social isolation, withdrawal, depression, and dementia as well. Sleep hygiene, again, is something we do not talk about. What do we mean by sleep hygiene? We're not talking about washing ourselves before sleeping. We're not talking about brushing our teeth before sleeping. And that's on a lighter note. Sleep hygiene is how well you're sleeping and the quality of sleep. Sleep increases, or rather, the poor quality of sleep will increase your risk of getting cardiovascular diseases, depression, and memory problems. Because our brain also exercises throughout the day, so it needs rest. Sleep is the time our brain is in rest mode and it's in rejuvenation mode. You do not get the right amount of sleep, and the right amount doesn't necessarily have to be 10 hours or 8 hours. Even if you're getting a good quality of sleep between 5 and 6 hours and you're completing the normal cycles of the sleep cycle, which is your REM and non-REM sleep, and you wake up refreshed, that is good quality sleep. Good quality of sleep is never induced by sleeping medications. There's a big misconception that I can't sleep and will give you sleeping tablets. Sleeping tablets are not really sleeping tablets, they're sedatives. And sedatives do not give you natural rhythm of sleep, they actually make it even worse. So if you have sleeping disorders and you can't sleep, it's important to understand why. Because almost every time you go into the history of a person with sleep issues, you're able to identify why, and then you address the why rather than just addressing the sleep. It is far healthier and it's far better for your brain. Like I said, the brain is a muscle and it needs to be exercised. So things like reading, doing puzzles, learning new skills, no matter what your age. And we say this to all patients, whether you have impairment, you're healthy, learning a new skill at any age, because we thank the Almighty, He has given us a brain that has the ability to constantly learn new things, even if you have cognitive impairment, even if you have dementia, you can still learn new things. It's called neuroplasticity. That is something, the nerve cells of the brain, that no matter what happens to your body degenerating, your brain is still able to learn new things. You may forget them, but you can learn them. And that learning new things helps delay dementia, helps delay the progress of dementia, helps you stay at bay from things like depression and delirium because you have a exercised healthy brain. Again, like I said, sensory issues will always link you to getting memory decline faster. So, hearing aids and glasses are a good thing to have. Sleeping habits must be maintained. Avoid late nights. Have regular sleeping times. Avoid caffeinated drinks in the evenings. Avoid using our phones because the blue light of the phone really causes disturbances in trying to fall asleep. And remember, supporting mental health is as vital as supporting the physical health. So, like I said, my questions are there. I don't like reading my slides because you can read for yourselves. But I want you to ask yourself these three questions. Are you around people you think who may have had memory loss that is not normal? Have you made the assumption that that's dementia? Could it be depression? Have you done what it takes to get screened or get assessed for it or take the person you love for assessment? How do you, at an individual level, keep your brain sharp and active? And if you've been in this situation, how was it handled? Next slide. Now, we come to one of the most important parts that for me, this is probably more important than anything I ever discuss with any patient, any webinar, any teaching: social connection and purpose. It has been shown through meta analysis that social isolation increases all cause mortality by 29%. What does that mean? It means that when somebody is isolated, they are at a 29% higher risk of getting uh, complications of illnesses, death, compared, and this is compared to things like obesity and smoking. It is very important to understand that being socially isolated puts you at the same risk of developing disease as you would if you are smoking or obese or having other reversible things. Okay? Loneliness is associated with what we call higher inflammatory markers, and that when you have high inflammation, you are at a far higher risk of accelerated cognitive decline. So, what we need to understand is on the neurobiological side, social interaction will stimulate certain parts of your brains, particularly your hippocampus and your prefrontal cortex, which is important in preserving your memory and your cognition. When you are not, socially engaged and all, you have a lot of cortisol. So when you're socializing, or you have good, so to speak, social support, your cortisol is reduced. You go into lower inflammatory spaces and lower cardiovascular risk spaces. When you are socially engaged, you have healthier behaviors than being isolated. People who are isolated tend to become turn to alcohol or smoking or sleeping and totally inactive lives. So when you're socially active, you have a lot of physical activity. You'll be discussing that, be conscious about it. You'll have healthier behaviors by communal support. And when you are socially connected within a community space, you get what we call a psychological buffer. It also helps you reduce the way you'll perceive pain, disability, and illness. So, just to put that into context, if you're involved in a community group and all of you are saying, "Oh, I have backache," instead of focusing on the pain and the amount of disability it's causing, you're going to look at each other and laugh about the fact that all of you are complaining about the same conversation. And it becomes something that helps you get motivated to keep going rather than being on your own, focused entirely on your backache, thinking you're alone, journeying this alone, you have no support. So it really reduces how you're perceiving the situation and changes it from a negative to looking at how it can become a positive space for you in how you manage it. Also, when it comes to social isolation and loneliness, your immune responses are reduced because, again, you are under a lot of inflammatory strain, which will increase your risk of infections and poor recovery. Group interventions like community support, social worker groups, intergenerational. We really strain on intergenerational because the younger people need something to do and they need to learn how to connect with older persons in a positive, where this is a positive space. Given that we are going to be far more older people than younger people, we need to create this mentorship space, interactive space. This will help improve mood of the younger people and the older person as well. Social prescribing is very important. Social prescribing is basically where you're linking older adults to social groups, volunteer work, community centers, and this works far better and is at the topmost of what we call the non pharmacological interventions in managing a lot of cases of different conditions in older adults, or also contributing to a person remaining healthy despite having illnesses. So, social connection is not a luxury, it is a determinant of health. And like I said, just to summarize, loneliness will increase your cardiovascular disease risk, depression risk, mortality risks. And all this is evidence based interventions where we talk about the community support, community engagement, intergenerational space. We also must remember in these spaces, you also end up providing support for caregivers, because caregivers are the foundation of healthy aging when it comes to older adults. Because when they are supported, they're not burnt out. When they're not burnt out, they're better able to care for our loved ones. And it improves a lot of the outcomes when we are looking at a holistic care approach. Next slide. Now we come to the fifth pillar, which is spirituality and emotional resilience. Research shows that spirituality and religious practices help with relieving the symptoms of depression and anxiety, and helps with coping mechanisms, because we have a space that is positive. You're being mindful when you're prayerful. It helps reduce blood pressure, improves your sleep quality, and it also helps build better emotional resilience. It's it shows that, when you're able to accept life's transitions, that's what emotional resilience is. It's We are all transitioning from one point to another, from a child to an adult, from an adult to an older adult, and in those spaces there are lots of things going on. So emotional resilience is when you're accepting those transitions with grace, with planning, with understanding. And as much as they may be hard to have, because nobody likes thinking about what if I'm going to be too old to walk? What happens when I can't see? But if I know that as I age, I'll be slower, I will be planning for it. I will know what I want to do. And that gives me a sense of purpose. It gives me peace. It gives me independence and dignity. And older adults who are known to feel useful tend to live longer. So, spirituality is one of the spaces where older adults can often be included: church groups, volunteer groups. A lot of my patients that I've come across go for Bible study even as older adults. And I found a lot of patients with dementia actually go back to Bible study in a community that understands they are struggling with memory, so things are adapted to their level. And these help them cope with a lot of things. When you have a strong sense of purpose, which comes through spirituality and emotional resilience, the risk of developing cognitive impairment is reduced by about 30%. So, just the strategy of having hope in what may feel hopeless encourages older adults to continue with meaningful roles, and it's a very therapeutic strategy. So, again, please look at the reflections, reflect upon yourselves within yourself, and understand why this space is important. Another area that comes when we're looking at spirituality and emotional resilience is we're looking at end of life spaces. Towards the end of life, we really get uncertain. A lot of people, including families caring for people who are towards the end of life, get uncertain in situations. And being at a space of spirituality helps you cope. It helps you adapt to the illness trajectory that is on a downward. It helps you understand that advanced care plans and end of life decisions and discussions are important, because then at that point you're able to avoid unnecessary hospitalizations, unnecessary interventions that are taking away the dignity of a patient rather than maintaining dignity. And this advanced care planning is one of the cornerstones of healthy aging and geriatric practice, because you're giving patients the best option. You're journeying with them, holding their hand right through till the end. You're not giving up on anybody, and having a strong sense of purpose, spirituality, emotional resilience contribute to being able to have these kind of conversations. Next slide, please. In a lot of places, access to healthcare is not really a pillar, but I like putting it under a pillar to healthcare because it is a critical pillar. Preventive care is often something that is overlooked in older adults. When I say overlooked, we always thinking, oh, when we fall sick, we'll deal with it then. But in older adults, you want to prevent things far more than wait for them to happen, because the impact of prevention is far more superior. Because of For those who had attended the webinar we had done on aging and physiology of aging, we spoke about how, as you age, your ability to bounce back after something going wrong is reduced. Your physiological reserves are reduced, which is part of frailty. So, if you're preventing any strain, you're far happier. Things like vaccinations, like vaccines for influenza, pneumonia, Shigella, tetanus, it definitely reduces the morbidity and mortality rates in those above 65, and including hospital admissions. You may not prevent the disease from happening, but you prevent the complications that come through hospitalization and other things by at least up to 60% with vaccines. And that getting a vaccine is important in this topic, because if you have access to healthcare and preventive care, then vaccinations come under the preventive measures. Secondly, what kind of healthcare do you have access to? Do you have enough time to visit your doctor where they're going to look at your 10 drugs, go through each drug to understand, is it still important? So that's where polypharmacy and medication review is important. Polypharmacy basically is the use of 5 to 10 drugs or more in patients all over the globe. And older adults, up to, I think, 50% of the older adults are usually undergoing polypharmacy. What is the impact of polypharmacy? The risk of falls is higher, delirium, renal injury, drug interactions, all that is so high. So it's important to use certain tools, which there's certain tools we use in geriatric medicine called the start-stop tools, or the Beers criteria, to look at the prescription a patient has, to identify what inappropriate medications may be, highlight what are important and may not be being used, and put them in place in a balanced space. When we look at geriatric care, when we're looking at healthy aging, why is it important? Because geriatric care is one of the few fields of medicine that look at a multidisciplinary approach. And when you're looking at that, you're bringing together the doctors, the caregivers, the nurses, the physiotherapists, the occupational therapists. You're looking at the person as a whole being, not in bits and pieces of conditions and diseases and disabilities. And you're trying to tie all of it together so that the patient is being able to live their best possible life, which is what healthy aging is. Functional capacity is at maximum for whatever space that is possible. So, something we call the geriatric assessment, a comprehensive geriatric assessment, is something that is highly recommended when you're seeing patients. Yes, it is a time consuming, slightly expensive investment. I call it an investment because it is important to know where you're at, what your capacities are. When you're looking at what we do as a CGA, and that's a whole topic of its own, and it would be great to discuss that, but we don't have, it's not part of the scope for today, is really important because it is known to give you a baseline which will help reduce your chances of ending up in hospital, delay caregiver burden, It will delay institutionalization in case you are in that space. It will give you the support at the right time for the right reasons. So you're managing yourself from all aspects that are important for you to healthily age. Then, when it comes to advanced care planning, again, I cannot stress upon this. It is something that is often delayed in our setup. As a country, as a culture, it's not something we embrace widely. Even writing wills is not something that we see our population being too open to doing. And that's why we end up with disputes in family leading to bigger problems and lots of issues come around. Advanced care planning is not about planning your finances. Advanced care planning is medical related, but when it is done early, it will improve quality of life. It will reduce unnecessary hospital interventions or medical interventions that are not aligning with the patient's values and what they want. It helps maintain dignity because, as a patient or as an adult who's aging, I would like to be able to make decisions for myself. An advanced care plan gives exactly that. So patient autonomy is maintained throughout, and it is something we're really hoping our mindsets can open up to accepting as a way of being part of our regular medical routine checks, that I would like this to happen for me should I be in this situation. It's hard to predict what life will throw at you, but it's always easy to sit with your doctor, get the guidance and say that should I be left in a impaired situation of life, uh, should I be in a space where I can't make decisions? What would I want my family to do for me? How will I make that burden of care easier on my loved ones who are caring for me? So it's also important to understand that when we talk about access to healthcare, it's not just about the availability of the hospitals, that we have enough. It's about ensuring it's the right preventive kind of service. It's the safe kind of service, including medication reviews and stuff. It's person centered at the right time, at the right place, in the right situations. We can go to the last part of today. I mentioned about caregivers. Caregivers are usually the unsung heroes, the people who are totally forgotten about in this journey of healthy aging and older persons. But it's important to keep their health and their care in mind because when they are ailing, the patient and the ones we are caring for will also ail. It is important that they must balance supporting independence with providing care. They have to also be able to live parallel lives. They need to watch out for elder abuse. They need to watch out for medication adherence and medication, adverse effects. They need to make sure that the patient's autonomy is being mentioned and is being cared for, and it's very essential. But at the same time, they also have to care for themselves because burnout is very real, and when you have family support, community support, medical support in trying to identify what we call caregiver burden, you help them be able to support the older person much better. And just helping them help the older person make decisions will go a long way in preserving dignity and maintaining quality of life. Caregivers usually lie at the heart of healthy aging. But what cost? You put so much on their shoulders that we forget that caregiver burden is the cost they go through. 40 to 70% of caregivers will go through significant amounts of stress, depression, anxiety, which may lead to physical health conditions. They end up with diabetes, blood pressure problems, lack of sleep, weight gain, weight loss that's not healthy. And how do we support them? There is something we call using assessments to assess their burden. And they're again validated medical tools called different tools are used. Something called the Zarit burden interview. It's the most widely used one. It kind of helps measure the physical, emotional, and financial strain on caregivers. There's something called the caregiver index strain, CSI, caregiver strain index. That's also a set of questions that you use, and we use it in clinics to assess the caregivers who bring in the older person or the person they're caring for. So we also, and this is all that is done in a comprehensive assessment, because them being strained will affect the patient or the older person inevitably in a negative. They will also help us identify when these people, as caregivers, are overwhelmed, are in need of interventions, and how do we help them? We help by, you know, having the options of respite care, where you can have one of your loved ones rest for a few days as the caregiver takes a break for a few days. Have caregiver support groups in place. You can have trainings for the caregivers to know how to self-care workshops, psychological support through counseling when they're going through straining periods of seeing their loved ones deteriorate. um, an advanced care plan really helps with caregiver support. And it's important to recognize the caregiver's role in the healthcare team, validating their struggles, understanding that they are humans doing a lot, because just simply those simple things goes a long way in reducing their burden. So to end the webinar, or my part on it before we go into the discussions, is to understand. We can go to the last slide. That healthy aging is the same as preventing disease, maintaining function, and promoting well being. It's not just about extending your lifespan, but extending what we call your health span. Lifespan is increasing years, health span is increasing the health in whatever capacity we can. It increases your health span. And how do we do this? By preventing disease, maintaining function, promoting well being. And what does this translate into? It reduces frailty, hospital admissions, and dependency. So, screening for chronic conditions is important as a routine, balanced lifestyle encompassing good diets, physical activity, cognitive. Sorry, I got a call coming through, so that disconnected me. I'm sorry. I was saying that a balanced lifestyle that is about encompassing a healthy diet, healthy activity, cognitive health, social engagement will all create a resilient, robust body to the extent it can be. Where our challenge comes in is us as healthcare providers, caregivers, clinicians, or communities. We have to challenge ourselves to ensure that the older person is going to age with dignity, with meaning, and with confidence. So, healthy aging is so much more than the years we live, but the life we put into those years. Aging is not a disease. Please, let's stop looking at aging as a disease. Aging is a privilege, and it needs to be celebrated with health, dignity, confidence. And you know what I'd like you guys to do today is, what are you taking home and putting into practice, not only for yourself, but for the people who you're going to interact with? Healthy aging remains the cornerstone and the biggest foundation block, not only for older adults, for even the younger person, because healthy aging starts as young as you can, because you're aging on a daily basis. So I'd like to thank you here and like to just say what I said again. Healthy aging is not about adding years to your life, but life to years with dignity, purpose, and care. And an older person is not a burden to carry, but a liberty, a library to treasure. And when we care for them, we preserve wisdom, love, and humanity. And that brings me to the end of what I was talking about. I know I have gone through it very quickly. So let's go through questions. Let's go through the discussions. I like having the healthy aging as more of an interactive session, because it's really important that we understand what means for me to healthily age may be different from how you will choose it based on your individual circumstances and situations surrounding your life space. Thank you.
Thank you, Dr. Tasneem. Thank you so much. Thank you for the presentation. Thank you for bringing the message of health aging home properly, simple, and clearly. And people with questions, please. There's somebody who has said, I'll pay more attention to screening, not treatment. More screening and not treatment. Because Dr. has said, the earlier we do things, the better. Let us not wait until we fall sick, but we should check on our health as early as possible. Yes. Any question, any suggestion?
I agree. Early screening is important because it will save us
Yes.
from a lot of. I'm saying I agree that early screening is very important because it will save us from a lot of other complications that go along with the chronic diseases.
Yes. Somebody's carrying up your hand. Sister Wanda, you are carrying up your hand.
I've already said, hello,
Yes,
can you
yes,
hear
I want
me?
to hear.
Yeah, I was saying I agree with the early screening because it will save us from a lot of complications.
And screening will save us from a lot of complications. And someone has put there, which which are the major ailments? Dr. Tasneem, someone is asking which are the major ailments to be screened, please.
Okay, so
Major
screening for major
ailments.
ailments, as we grow older, is different for males and females, of course. But of course, things like diabetes, blood pressure, hearing, eyesight, your cardiovascular health overall. For males, prostate; for ladies, breast cancer and cervical. We are also looking at cognitive screens, depression screening. All these things become very important as you age. And for people who are above 65, remember I mentioned something called a comprehensive geriatric assessment. It will go through quite a lot of the screening. We'll check on mobility, we'll check on muscle strength, we'll check on your nervous system, on your cognitive health, on your mental health, on your environmental factors. So when it's medical, things like diabetes, blood pressure, the different cancers that are high risk but treatable, cognitive screening, depression screening, and anxiety screening remain integral. Bone health remains integral. Eyesight and hearing. I hope that answers your question.
Sister Wanda, you have heard that. Thank you.
Thank you.
There's somebody who is saying, how can we promote health aging for the rural folk who may not have access to information such as this, chance from the YouTube? This information can be given to the rural people because CASAK is training, and CASAK has people. When they are invited, they will go and give this information to the people, even in the village. So whoever has people in the village to be talked to about this, we are available and we are willing to do it. Another one says, what are the good exercises to do from 50 years and above? Dr. Tasneem?
So for exercises for healthy aging, in general, it doesn't always necessarily mean 50 and above, include 4 areas. One is balance. Two is strength training. Strength training is actually the most important. When we are looking at strength training, you're looking at things like light weights, body using, like, just sitting on the chair and doing squats, sitting up, standing up, leg extensions, things like that is good for strength training. You're using your own body's weight to strengthen it. Aerobic exercises like walking, swimming, even dancing is considered an exercise. Cycling, if you're not able to cycle a bicycle, you can get those stationary bicycles. It's very important. Balance exercises like standing on one foot, yoga, trying to stand up from a chair, from sitting position without using your hands helps with creating balance. Walking from like if you're walking in a straight line, you do what we call heel to toe walking, which will help you maintain balance. And these are really important for preventing falls. Then, of course, flexibility and mobility, stretches. And when you're stretching, you're not just looking at stretching your hands outwards, you're looking at stretching every part of your body, all joints in different ways. So, structured exercises that focus on these 4 key areas: flexibility and mobility, balance, strength training, and a little bit of cardio, aerobic exercises. I hope that's answered it, or would you need something more specific?
I hope that one answers that. Whoever Francie, someone is asking, also in the rural areas, the support group not be as huge. That is financial officer. You are asking also the rural areas, the support group may not be as huge as it is in the urban areas. So how do we help our rural folks? Rural people are very many. Once you inform them, they'll come. It's only you who is not informing them. Create awareness, tell them there is this kind of thing. People in the village will come because they want to hear a lot of information about this. So create awareness and call these people. You stay here.
Can I come in?
Any other question? Any other comment?
Sister
My hand has been up.
Quinata.
Can I come in?
Yes, go ahead.
Okay. Thank you very much. I joined this meeting late, but it has been very informative. My name is Titus Agoro. I work with the Aging Concern Foundation. Yes. And we have implemented the healthy aging projects, especially in the rural communities. I really do like the question that has been posed. I wanted to comment on that question, the one that has been posed on targeting rural older persons, and I pray that we don't dismiss them. That's a really good question, because healthy aging is not just for those in the urban settlements. It's for all of us, those in the rural areas, those in the urban areas. Something I can say based on the projects we have managed to implement in the rural communities around healthy aging, and there are just 3 things that I will summarize quickly. That we have seen create a lot of impact, and if there will be a chance, I can share project video that we documented on increasing healthy aging services for older people, maybe after this meeting, if there will be a chance. So one, just the way the immediate speaker just said.
Yes.
Can I go on?
Yes, please.
Okay, thank you. I'll be brief. So just like you have said, one way that the rural communities can engage on healthy aging, and this is probably to address the pillar that Dr. Tasneem talked about on loneliness and isolation, is of course being part of community associations. There are very many groups of older people. There are very many youth groups, women groups at the community level, at the county level, at the sub-county level, at the village level that everybody can plug into. So that definitely is one area that even those in the rural areas can easily jump into, be part of an association, be part of a group, to be able to eradicate issues of loneliness and isolation. I can tell you from lived experience, my mother is 76 years now. Every Wednesday, she goes for some group meeting, every single Wednesday. So I'm so sure there are such formations almost everywhere else. Number two, on the other pillar, that the first pillar actually, that Eric talked about, that is on physical activity, which is very, very important. Again, we are advocating for formation of community exercise clubs. Again, that is something that many other people recommended from the engagements we had at the various rural communities that we had our project. So formation of community exercise clubs, so people just a call came in and interrupted. Please just confirm you can hear me.
Okay.
Sorry, you can hear me. I'm just in the final one.
Yes.
All right. Dr. Tasneem, you can hear me?
Yes, I can hear you.
All right. Thank you. Great. So the first one I've said, community associations. Everybody in the rural areas can plug into that. Number two, formation of community exercise clubs. Again, these are things that we are witnessing. They are happening. We have them. And so, again, those who are working, especially in the communities, those are suggestions that you can make to the groups that you coordinate for physical activity. It's crucial. It is important. And then the last one is empowering existing government structures. For us in Kenya, we are lucky with the evolution of CHWs, community health workers, to community health promoters, who are working at the very local level down there. And therefore, these are colleagues that can be engaged on issues healthy aging. And so that when they go to the villages, to the doors of these people, they know what to talk about when it comes to issues healthy aging. So those three are my suggestions and recommendations that I can quickly highlight to that question that was on targeting people, especially those in the rural areas. Community associations, community exercise clubs, and working closely with community health promoters. Thank you.
Thank you, Titus. Thank you. Thank you so much. Thank you so much. Someone was asking, from what age are you considered an older adult? Daktari, someone is asking,
It's
at
from
what age?
60 to 65, depending on the geographical region you come from. But yeah, above
Adults even
60 is
from 60.
considered in the older adult space.
What is the first pillar, please? Sorry, I joined late. Someone is asking for the first pillar.
The first pillar was about physical health and activity. We'll share the notes, so I think you should be able to go through them. But it was about physical health and activity, the importance of it in the different areas of healthy aging, or what would contribute to you being able to healthily age. Sister, I'd like to just add on to a few things Titus was saying, or to answer that question on how do
Yes.
we how do we engage with
Titus said
community
something.
members,
Yes.
community
Yeah.
members who are in the rural spaces. This is where the whole intergenerational gap closure comes in very, very important. If we are able to educate, I mean, I think we live in a culture that if nothing else happens, at least once a year, we visit up country to visit our older adults. Whether it's Christmas, whether it's Easter, whether it's a birthday, or whether it's a communal affair that may be happening. And if our younger generation are empowered on how to interact with the older persons, and through those interactions and activities they do, they will educate the older person within a community level at the situation they're able to. Because if I went to up country and started talking to Shosho who's 110 about doing physical exercise, she'll probably take her stick and chase me away. Yet she's the one walking around with a stick at 110. So you see, we have to learn how to adapt what these messages are to the situations that are on the ground. So what is important is now when you go to Shosho and see her there and she's walking with her stick, for you is to remind her that how she needs to be safe. If she insists on walking without a stick because she feels she's independent, It's good to see how you're talking to her. If you find you need to raise your voice, that alerts you as a person that this person may be going through hearing issues. And you can't enforce things upon older people. So how do? You do it in a way that it's coming from them in a way they're able to understand and accept. Because a lot of times we want to reinforce things by forceful interventions, by saying, no, you're old, I need to take you to Nairobi, I need to make you do ABCD. It doesn't always work there. So when it comes to the rural spaces, look at the situation, see what's already working. We already know most of our grandparents and parents who are aged in the upcountry areas are already very physically active compared to even us, because they're always tending to their things on their own. How do we ensure we encourage that to go on? By making sure they remain safe. Because if they have a fall, they're going to stop being able to be physically active. So you start now going to outlook, as the younger generation, we need to be more empowered to be able to empower the older adults out in the rural areas. I don't know if that makes sense to the person asking that question, and if that's something they see being able to be applied out there. Even when it comes to medication review, we often find they're on medicines they were given 50 years ago, but nobody has taken it. So it's good to find those
Any other
CATPs that.
question? Any question? Any question?
Yes, I can ask.
Yes, go ahead.
There are times you go in the rural area and you find there's this older person around 80, 85, and it becomes very hard to see how you can support this person. You realize that he has a lot of muscle wastage. Is it possible to have some way of repairing or picking up on what has already gone down?
Like we said, as we
Yes.
age, sarcopenia is a real
Yes.
situation. And with that real situation of sarcopenia is muscle loss. So it's about finding out why they have wasted. Is it a nutritional thing? Is it a movement thing? Because lack of movement, incorrect nutrition, incorrect activity can lead to these things. So when you identify the cause, it becomes a lot easier for you to be able to um, help the situation. You may not be able to reverse it fully, but you can still maintain what is able to be maintained. I hope that answers you.
Any other?
How would you get it repaired? Like,
You start rehabilitation. So if somebody is sarcopenic and has lost a lot of muscle, they need to be exposed to the correct diet, the correct physical activity to build strength again and to build muscle again. Patients, I've seen a lot of patients, and this is very practical approach. Patients who have been hospitalized for 3 weeks, when they come home, they can no longer walk. Physical therapy and occupational therapy has done wonders, where this patient within the next 3 to 6 months is then able to walk, either assisted with a cane or with assistant, help to walk, but they're able to at least walk. So you rehabilitate them, which involves a lot of physical therapy and nutrition.
Any other question? Any comment? You'll get the notes that be posted. Any other question? Elizabeth?
Hello.
Murimi, you
Yeah.
have something? Yes, Elizabeth? Yes.
I just want to ask. I have a parent who got a stroke after the death of my sister. I think she got a lot of shock. Then from stroke now she's weak, but she tries to walk. What we do, we had helped her to have some machines to do some exercises, but she feels so bad because she can't work as before. How can we help such people?
That's why Dr. was telling you rehabilitation is the first thing. And you have to
Yes.
take her gently. You have to find out how to start. You don't just tell her now you have to do these exercises. The machine you bought, did you buy because you were told to buy, or you thought you needed to buy a machine for her for exercise? You know, that's another thing.
It's a physiotherapist who suggested this just for movement of the hands. She
Yes.
does it little by little.
You see, also, when you have patients like
Yes.
this,
Does she
remember
have a
it's
caretaker?
rehabilitation is not only physical. Rehabilitation is also mental and cognitive. So when a patient has been put through a space where
Yeah.
they have disability, remember what I said, healthy aging is not the absence of disease. It's how to get the best functional outcome, the best possible. So even if a patient has had, like, for example, a stroke, we feel they can't walk, but there must be something they can do. So it's about changing the mindset to focusing on what you can maintain and what you can do rather than focusing on what is lost and cannot be repaired. And when we change that mindset and we rehabilitate it cognitively, mentally, and physically put together, you find a big improvement in patients. It's a journey. And more often than not, what families feel is when we talk to our family member, they're totally hopeless, they've lost hope. But these are patients who may be sitting on the brink of depression. So we must assist them in that space and give the adequate support. And support is not always, sometimes you need expert support who will journey with that patient because you have to rehabilitate the mind as well. It's a slow journey, but it's not impossible. What is easier to do is to just leave it and say they have given up. But even when somebody gives up, we can still rehabilitate them. It's a skill set that you learn in the space of geriatric medicine, in the space of palliative medicine, in the space of healthy aging.
Thank you.
Then, Rose, you have got that?
Yes, thank you very much.
Yes. Yeah, we go slowly. You don't just push things because they have said. You go slowly, and you remember it. You said she got
Yes.
this after the death of her daughter. So you can imagine what it meant for her losing her daughter. So she needs to be rehabilitated from that. She gets into the system. She gets to talk to people, and people support her. That's how she'll want, because maybe she has maybe in the first place, maybe she's in depression, and here you are forcing her to do exercise. It will not work. You must bring her out of that depression. You must bring her out of that pain before you can continue with what you are saying. What could be the cause of irregular sleeping habits? Daktari, there's a question there. What could be the cause
Irregular
of
sleeping
irregular?
habits. Irregular sleeping habits can come out of psychological strain, overstimulation of the mind in the evenings, something we call sundowning. You can have sleep problems because of pain. You can have sleep problems because of a cognitive impairment. You can have sleep problems because of nighttime wakenings, because of having to go to the washroom several times and then you are unable to go back to sleep because of that disturbance. Um, the kind of foods you may have taken in the evening, like a very high sugary food, will impair it, especially in women. Sleep starts becoming very irregular. So you have to start maintaining things that you can trigger because hormonal changes affect your sleep cycles as well. People around the menopausing age often undergo sleep irregularities, and it's very important to address those issues early because then it becomes a habit not to be able to sleep and you get used to it, which is not healthy.
Thank you, Daktari, for that. I hope you have understood the issue of irregular sleeping habits. And in women, you have heard about the hormonal imbalance. So when the good hormones go down, you find you are having that problem. Thank you. Any other question or any other comment? Any other question?
Yes, I would like to ask the food, the issue of food in the evening. I know of somebody who says that maybe taking an egg as the last thing in the evening, taking a cup of warm milk, but do they really help? And somebody may not be able to be taking an egg, may not be healthy taking an egg every day. What can be done?
Doctor, you get that question?
Sorry, I didn't hear that question very clearly.
The question is, she's asking what happens with the taking the meals in the evening. There's somebody who takes an egg in the evening, or another person has to take a drink in the evening. What is it, or what's wrong with that?
Okay, it's not about the meals, it's the type. High sugary foods are stimulating. So we say when you're fully stimulated, then you have more release of energy and your brain gets overstimulated. So it's not general foods, it's type of foods.
I hope you have gotten that, Rose.
Elizabeth.
Elizabeth.
Yes.
Is that it's Elizabeth? Yes. Any other question? If we don't have any other question, we like to thank the doctor, Dr. Tasneem, for the good presentation, which has enlightened all of us on health aging. There's somebody asking, what is the recommendation for feeding in the evening? Dr. Tasneem, before you leave, there's a question.
Feeding in the evening, I mean, you eat regular meals. We just say avoid things that overstimulate the brain. Our evening meal should be the lightest meal because remember, in the evening, you're going to go to sleep. When you're going to sleep, your energy requirements are very minimal. So you need to feed with things that are not high energy foods, but more of muscle building foods. And in older people, we say the protein intake is what matters more. So avoid high starchy foods in the evenings is one thing. Keep the meals light. Avoid sugary things in the evening. Avoid hydration in the evening. Try and hydrate earlier so that it's not interfering with your sleep because of needing to the washrooms over and over. Because older people will tend to drink, and then avoiding caffeinated drinks in the evening is very, very important because that affects the sleep. I think, overall, that's what you look at when you're trying to, watch what you're eating in the evenings.
Thank you, Dr. Thank you. Any other question? Any clarification that you want to be made? We are talking about pillars of health aging. How do you want to age? We have been explained. Any other question before we close? Thank you, Dr. Tasneem, for the good presentation. I want to believe those people who attended our webinar have gained a lot and they have a lot of information to share with other people who need this kind of information. CASAK is training caregivers, and for those who don't know, we have enrolled a class, it's already on, and the next class will be enrolled in January. We train caregivers on all this information, what Dr. has even taught us, so that the caregivers are well equipped when they go to in the village, when they go out, they're able to take care of our elderly people with a lot of confidence because of the skills and knowledge that they have gained from CASAK. If there's no another question, I would say thank you so much, Dr. Tasneem, and we hope to have another webinar, God willing, in 2 weeks' time. We shall be putting it up. Thank you.
Asante.
Thank you,
God
Dr.
bless. Thank you very much.
Thank you so much.
Thank you.
Thank you. It was very rich.
Thank you.
Thank you. You're welcome.